Can you tell us a bit about at MAPS how you help trauma victims? Especially there's a lot of emphasis put on people that have PTSD. And
Yeah,
I know that you use MDMA to help a lot of these people.
yeah. Okay, so um, we are the only company right now that has psychedelic-assisted psychotherapy in phase 3. And we had to do a big strategic discussion. This is now 35 years ago, but what drug and what condition?
Yeah.
And in 1984, I did work with a PTSD patient and saw that it helped her with MDMA and also with LSD MDMA combination. And so I knew that MDMA for PTSD is terrific combination. So we have a 3.5 month therapeutic process. The first thing to say is that a lot of people are traumatized, but only a fraction of them get PTSD. So
Hmm.
people are able to be resilient, to heal from trauma a lot, but some people aren't able to do that. And it's often the case, but not always the case, that they've had difficult experiences in childhood. So that when they have trauma in their adulthood, they have a hard time getting over it because they're also wounded from early on in childhood. Now, again, it's not always the way, but so what I mean is where this is going is that we have a two-person therapy team, often a male-female. That's our preferred model, is a male-female team. And of course, we're open to all genders and non-genders and, two female, two whatever. But it's basically this idea that a lot of people, when they do MDMA, they talk about all their traumas, and a lot of them go to childhood, and you have this healthy male-female relationship with a therapist, which they might not have had when they were younger. So it's 3.5 months treatment. It's 42 hours of therapy. And the way that's set up is it's 3 8-hour sessions with MDMA. And they're about a month apart. And then it's 12 90-minute non-drug psychotherapy sessions, three more or less once a week before the first MDMA session to build the therapeutic alliance, to get people to know each other and to prepare people for the MDMA. Then there's three of these 90-minute sessions after each MDMA session to help people integrate it and think about what happened and try to um, learn how to process trauma on their own in a way to heal themselves, to be able to learn this process that it's not so overwhelming. You don't have to keep suppressing it, because the thing about PTSD is that the trauma is never really fully in the past. It's always about to happen. It's always
Yeah.
reminded people of it. So you want to help them process it. So it's 3 day-long MDMA sessions and 12 90-minute psychotherapy sessions. And our therapeutic method, which is what we've done, is it's called a treatment manual that describes our therapeutic approach. And so people go to maps.org, our website, and go to research and MDMA. At the bottom of that page is our treatment manual. But the essence of it is that we believe that we all know that if your body gets wounded, there's a wisdom of the body to heal itself. There's
Mm.
limits. If you lose a leg, you're not going to regrow a leg. But
Yeah.
if you got a big wound or a cut or all different things, our body heals itself below our level of conscious awareness. And so we believe there's something similar for the psyche, and that when you give somebody a psychedelic, there's this emergence into awareness of different feelings and thoughts, body sensations, all of that. And there's a wisdom to the order that things come up. That's so we're not the guide. We don't use the word guides. Therapists are not the guides. Each person is their own guide. So
Hmm.
the best example is a midwife. We're like the midwife. The patient has to do the hard work. We're trying to empower them to heal themselves. We can be reassuring. We can give some advice. We've seen this before. We've seen that before. But basically, we call it inner directed therapy.
Yeah.
And people are 8 hours in a therapy session. They're listening to music. They're having headphones on. They're having eye shades. About half the time they're inner focused. The other half the time they're in dialogue with the therapist, but no particular order, and it varies with each person or each session. And we kind of support what's happening to people.